G'day everyone. It is Wednesday. That means, of course, we are going to get ready to prepare ourselves for the 2025.1 KFP exam. My name is Kane Treble. I am a GP based out of far northwest Victoria, and I'm here to help you get through. So glad to see some people joining in here. Hello. Great to have you back again. If you are joining us again, this is the second live stream in this series, and we'll be continuing this all the way through until we get to the exam day. Now, I am always a fan of trying to make as many resources as possible, try and get as much information out there as possible. And so I've been doing some playing around, and I've made something that hopefully doesn't make me redundant, but hopefully you guys will all find it useful. So if I just bring up here, I would like to introduce you to everyone's favourite new friend, GPT. We all have been using ChatGPT for something or other, I'm sure, and it dawned on me, why don't we use it for generating KFP type questions as well? So this is the Generally Practicing KFP Short Answer Question GPT that I have made. The link for this is down in the description, so if you want to open it up, play around, have a shot, go for it and see how you go. To give you a little example here, let's say we'll use one of these provider things, generate a postpartum depression KFP question. And I have put in a whole bunch of different cases, different parameters, different resources to try and build up cases here. And as you can see, it gives us a nice clinical stem, gives us some examination findings, and asks us what these questions could be. It's still a work in progress. There's still a lot of diagnosis, investigation, management kind of things, which admittedly are actually, what a lot of the KFP exam is actually about. I'm trying to make it be a little bit more organic in the way that the KFP exam itself is. And of course, we actually have some answers put out here as well. This will even try to group. The grouping's not fantastic. Again, this is a work in progress, but have a play around, see what you think, see how you like it, and look, I'd really welcome any feedback to try and make it as good as possible, because ultimately this is one of those exams that the more you practice, the more questions you can do, the better, bearing in mind that a lot of this is about the formatting of the answers, and so we should take that into consideration. I haven't got grading responses yet, and I'm still not fantastic. I'm still not very happy with the way it's currently wording answers. For example, here for question 1.4, you would definitely be in overcoding territory for putting that in there, but I want it to give you ideas of the type of answers you can put in. Check it out. I'll be trying to improve it as we play along, but of course, otherwise, we always go through some questions here on this live stream. We are 45 days to the 2025.1 KFP exam. And while I'm sure you're all getting into exam mode, getting ready, I also want you to have a little think about what comes next. I want you to start planning now how you intend to navigate post-GP fellowship, because it's going to come much faster than you think about it. And I want you to know how to actually prepare for this and what it actually means. So let's start off. First thing you should do is celebrate your achievement. Celebrate the fact that you have gotten through, and I want you to actually plan something, as weird as this sounds, to achieve that. Have a think through on everything you've achieved so far, all of your career goals, all the way from getting through medical school, which, let's be honest, is worth celebrating as well, all the way through to joining the training program and now succeeding on the other side. Just like each of those steps you've been through before, we have mentors. We have people that help show us the way, whether it's our teachers, our educators, our instructors, all the way through to our GP supervisors. I want you to find someone that you can still stay linked in with to maintain that mentorship program, preferably someone that's had many more years experience than you have, and use them as a bit of a lodestone. It's a bit of a idea of how you want your career to progress, because I think it's very easy to think, well, I'm done, I'm unleashed onto the world, I can do whatever I want, and we lose that bit of camaraderie, that bit of guidance from those who've been there before. And of course, for everyone that you've been studying alongside, stay connected, swap details, send messages from time to time, because I think it's a really valuable thing to keep in contact, keep those professional relationships up, and it can be at times lonely being in general practice, and so I want you to have all of those kind of supports in place as well. Now, a topic of great frustration for many people is understanding what the employment structures are, whether you're going to be gaining contracted employment or if you're actually going to be an independent contractor. You should be having a think about that now, having a talk to the clinics you intend to work at, to find out what kind of employment opportunities they have, because that may dramatically change the way you need to approach your financial situation moving forward. And have a think about what kind of agreements you're going to be participating in, what kind of billing percentages is usually the big one, you're happy to accept or not accept. Once you start getting into the nitty gritty, once you start thinking about the clinic you want to work in, if you do know that clinic, start having a think about those legal and financial counsels. Get a good accountant who's familiar with general practice and what it actually means to be an independent contractor, and particularly if you're going down that pathway, and try and learn now as much as you can about that process, because before too much longer, you're going to be a fellow and need to have all this in place to be practicing. And so you don't want to be trying to awkwardly scramble around in the last couple of weeks trying to get this set up. Now, of course, for financial planning and the business acumen, I want you to make sure when you're setting yourself up as a business entity that you actually choose the right business structure for you. And this is why from now I want you to be actually exploring what all those options are and speaking to someone that knows these setups and knows what's best for your specific circumstances. Likewise, start once you establish what your percentages and billing cycles and things like that will be, have an effective budget in place for how you intend to manage the first 6 months of your practice and how you might want to continue beyond that as well. Allocate some time to actually review how you're going, what your progress is, how your savings are, and make sure you understand your tax obligations. You should be setting up from very early on multiple bank accounts in order to separate out or hide, or hold rather, is probably a better way to put it, rather than hide. Hide sounds like tax evasion. I want you to hold money in different accounts to be able to safely allocate what you can and can't spend, what needs to be held for other things. This is actually easier than ever. A lot of online banking setups will now offer pretty much instantaneous new account setups, and most banks can even let you have multiple, let's say you're dealing with a mortgage, you can actually have multiple offset accounts contributing to that, where you can have that money sitting there helping minimize your interest rates while you have it safe and don't have that direct access to it that can tempt you to potentially overspend. Now, another thing that's really easy to accidentally do is to fail to continue your education. Once you've fellowed, you need to make serious efforts to make sure you're actually keeping up to date. It's easy to lag behind if you don't have people pushing you forward. So make sure you engage in CPD activities, that you're attending new fellows events, and RACGP always have a list of different events running. Try and set yourself learning objectives. If you hear about something new that's come out, or you're flagging a condition that you don't know much about, make sure you actually dedicate some time to brush up, learn up, and see how things have changed as well. And of course, it's all about maintaining your professional competence, so make sure you're signed up for a CPD home, which is also important for your ongoing registration. And at the end of all this, as we like to try and sneak in, make sure you're actually looking after yourself as well. Make sure you're prioritizing your well-being, and in particular, one of the main things most of us come to general practice for is that work-life balance. Try and give yourself boundaries. The time that you start at and the time you finish at. Try and make those hard times that you do not cross, to make sure that you're leaving work at work and home at home. Now, I work in the country where if I go to the shops, I need to set aside an extra half hour to chat with all the patients that I run into and try and avoid reviewing their rash in the veggie aisle. Has actually happened. Don't want to talk about it. Have a think about how you're going to handle that, how you're going to handle the stress of new fellowship, because it is significant as well, and how you're going to seek support when needed, and explore things like employee assistance programs, and making sure you have your own support network activated as well. And always, always, always try and foster a personal interest. Have something completely unrelated to general practice, medicine, and just something that recharges your emotional and social batteries at the same time. Of course, we are all here tonight to prepare for the KFP exam. We have 3 cases prepared, each with 3 different questions. And so, let's put 2 minutes on the clock, and your time starts now. time is up. Let's have a look at some answers. This is one of those cases where you just have that pit, that sinking feeling in your stomach where you think, oh, this is not going to be good. So of course here, this is something where reading through, we're pretty sure we know what the diagnosis is going to be or something along those lines. And this is where the KFP shines in terms of not just assessing kind of what you think the diagnosis is, but take that next step then. So this question's saying that not only do we want 3 specific examination findings, things we're looking for, but apply that to the setting of the most likely diagnosis. So here some examples would be pallor, suggesting anemia, bony tenderness over the ribs or spine, and admittedly there is a little bit of overlap here between the history that's been provided versus what those examination findings are. In this case, you would definitely get the marks there because it's a difference between diffuse bone pain versus eliciting that bony tenderness. Eliciting the symptom is the examination finding itself. Now, of course, with this, we're also potentially going to see things like reduced height or evidence of kyphosis suggesting vertebral compression fractures. I don't think you should use the word or in there. I think you would specify reduced height or evidence of kyphosis, not both. That makes sense. I just use the word to describe the word not to use. You get me. And of course, hepatosplenomegaly, increased activity of those organs and engorgement. As we get to kind of the potentially less specific things, we're getting into going from 2 marks per one of those responses through to kind of 1 mark per one of these responses. And this would be things like evidence of peripheral neuropathy or reduced sensation in the hands or feet, something along those lines there. Evidence of mild infections or chronic or recurrent infections. Evidence of bruising, blurring of vision or decreased visual acuity, being the changes to the viscosity of fluids within the body, and peripheral edema, having that increased fluid retention and reshifting of fluid into different spaces also would get you a mark. Now, of course, we still haven't actually given away what it is, and that might be relevant to upcoming questions. So let's move to question number 2 then. Let's get 2 minutes on the clock and your time starts now. All right, time is up. Let's have a look at the answers. And of course, please note here again, we haven't actually given away what the diagnosis is yet, but it's asking you to again take that next step about what investigations would be appropriate to confirm the most likely diagnosis. So for this, we'd be doing our initial, sorry, I should specify what initial investigation. So this is our first line kind of things. What would you do for that initial screening? So here we're going to, of course, go to our serum protein electrophoresis. And again, if we want those bonus marks to specify why we're doing it, to identify monoclonal paraproteins. We'd be looking at serum calcium to assess for hypercalcemia, as you would expect with bony metastases, as is being hinted at in the history. A complete blood count to evaluate for anemia or pancytopenia. Again, I wouldn't use all, but things, if you're putting one or the other kind of thing, you're definitely getting good marks there. And of course, the big thing in the STEM there is about that bone pain. So plain x-rays of the axial or appendicular skeleton to assess for those lytic lesions / fractures. I think if you're saying either axial skeleton or appendicular skeleton, lytic lesions or fractures, you're going to get those 2 marks there. Now, moving on as well, we'd also be doing urine protein electrophoresis, looking for those Bence-Jones proteins. And of course, serum creatinine for calculation of our renal function, which is potentially going to be impacted here. Having a look in from the chat, we also have mentioned here tachycardia, which, this is looking like responses from the last questions. But yes, all of those would definitely be fantastic answers for that last question there. Okay, so let's have a look then. Moving on to the third question for this case. Let's get 2 minutes on the clock and your time starts now. All right, time is up. Let's have a look at those answers. So lots of options here, but we do notice we do have some grouping in. So again, we want to specify the urgency, what we're doing and why we're doing it. So here we'd have a standard or a semi-urgent. I think you'd get away with either or. Referral to a physiotherapist for that supervised strengthening / resistance exercises. So one or the other there, specifying why you're doing it. 2 marks, fantastic. Suggesting participation in low-impact aerobic activities like swimming or walking to build endurance. Standard / semi-urgent referral to a dietitian consultation for a tailored high-nutrient diet plan. Try and build up some of that weight again after the loss of weight and deconditioning. A standard referral to a occupational therapist to assess and improve activities of daily living. Again, I'd be a little bit nervous about the word and for the assess and improve. I'd probably stick to one or the other. As long as you're having something in that kind of framing, I think you'll be okay. And really that's about trying to say, well, okay, you've deconditioned now, so certain things about the way you live your life are difficult. How can we modify the life to make those things easier or more achievable for you? Of course, standard referral to psychologists to address treatment-related stresses or exposures, fatigue, depression, reactive depression, things like that. Recommending energy conservation techniques to manage fatigue. So actually pacing herself would hopefully take away some of those difficulties around feeling deconditioned. We should also advise regular sleep hygiene practices to improve overall recovery. Again, if you're kind of starting the day with a charged battery, it's going to set you up for more success. And of course, a standard referral to a social worker to explore community support services. Also really, really helpful for these kinds of situations. Okay, so of course we've got a few other cases prepared for tonight. So let's move on to case number 2. First question will come up. Let's put 2 minutes on the clock and your time starts now. All right, time is up. Let's have a look at some of the answers here. So Gillick competence is one of those really tricky things that I think we all know of. We have an idea in our head, but ultimately it comes down to maturity and understanding. So the first part of Gillick competence or assessing Gillick competence is that the patient actually has the maturity to manage influences on their decision making. They're not going to be unduly influenced positively or negatively in any way. They're able to actually independently make up their own mind about the decision. So the next part of it really is about the understanding, and with that comes they have to first of all have the ability to understand the medical issue. They have to understand the proposed treatments. They have to have the ability to weigh the benefits versus the risk of all the treatment options, and of course the ability to actually communicate the decision clearly. So all those first bits are going to get you 2 marks. The ability to communicate the decision clearly is slightly less worth a mark in there. And it's really about that kind of patient autonomy, capacity and competency assessment as we do multiple times a day. Applying the Gillick frame in particular really has that little aspect on, do they actually have that maturity? Do we think they've actually hit that maturity milestone, so to speak? Coming in from the chat here, we've got demonstrates independence in daily activities. Yeah, and I think that's a good little proxy of, do they have that maturity? Able to understand harms of treatments, fantastic. Benefits of treatments, fantastic. Able to weigh up harms and benefits to arrive at a decision. Yes, yep, good. I would be a little bit nervous about having the harms and benefits, then the ability to weigh up, although it is, I think that is pretty appropriate actually. I would consider rewording just to avoid that potential thing around diversity of answers, but I mean, really it's the same thing as so just worded slightly differently. Definitely be getting 4 marks there, I'd say. Very well done. Okay, now we've all had those tricky cases where we've had to kind of decide for ourselves, does this patient actually have Gillick competency? Now I think on top of that as well, you also need that little bit of a pub test, so to speak, a little Australian colloquialism of, if you were telling this story down at the pub, do you think people would be looking at you a bit funny? And if in your head the answer is, oh, I'd probably get a few odd looks, to have an extra, maybe a bit of a think about the decisions you're making. One way to look at it, I guess. Not legally binding. Of course, let's move on to the next question then. So we'll put 2 minutes on the clock and your time starts now. All right, time is up. Let's have a look at the answers. So it's not uncommon for questions in the KFP exam to be based off procedures and describing how you do the procedures. And a part of that is, assessing one, what the procedures actually entail. I'm saying procedures too many times. But also, how do you actually go about consenting that patient for it? Often it's around things like excision of skin lesions, but not uncommonly you'll get something, a simple procedure like intravenous cannulation. So, of course, the things are going to be gather all required equipment. Yes, spelling it out to something that simple is definitely worth marks. Identify a suitable vein, clean the insertion site with an antiseptic solution, allow clean skin to dry completely, insert the cannula at a shallow angle, advancing until blood return is visible, secure the cannula with an adhesive tape, and connect the IV saline for administration. I have realised that last one probably is not actually going to be given a mark, given the question actually specifies provide 5 specific steps required for intravenous cannulation, and connecting the fluids is not actually a part of that. So look, I'll kick myself up the bum for that one. Now, coming in from the chat here from Demir as well, we have apply tourniquet. Fantastic. Yes, would definitely get a mark for that. Not in this list, but would definitely be worth a mark. Find a good vein. Fantastic. Prepare your trolley. So, yep, that's part of gathering all required equipment. Wash your hands. Fantastic. Definitely wash your hands, and that should definitely be in my list. Aim and shoot. Excellent. Hopefully you're meeting with the cannula and not like with a shotgun or something, but hey, you cannulate the way you feel comfortable. Excellent. Let's move on then to question number 3. Let's get 2 minutes on the clock and your shooting time starts now. Time is up, and let's have a look at the answers. This is one of those really frustrating questions where there's lots of things you could do for this patient, there's a lot of things you would do for this patient, but what this is kind of asking behind the scenes is, what do you know about the current recommendations from the Australian government about managing online bullying and harassment? And so part of this then would be knowing what government pages to go to, what government resources to go to, and there is actually a little checklist out there, and I'm pretty sure RACGP even put a little thing out as well a little bit back. But the big things there are: do not respond to messages, take screenshots to report, to keep the evidence to report. Not a part of this answer, but I think something just good to know from a practical viewpoint is that for a lot of people, actually having those things on their phone can be a source of distress. And so it's recommended that if that is the case, they should send the copy to a parent or trusted adult and delete the original messages from that device. Next thing, of course, is to block the offender from the device, services, or apps. Of course, we'd be specifying just one of those for an answer in the exam. And again, as a practice point, after you've taken the screenshot and secured that somewhere. Next step is, of course, to report the cyberbullying to the game/site/app that it occurs on. To report the cyberbullying to eSafety, so it's part of the commission to investigate and regulate eSafety. If you don't know what it is, I strongly encourage you to go check out their website and have a bit of a read, and this is where a lot of this material actually comes from as well. Report the cyberbullying to more than one trustworthy adult, and of course to report the cyberbullying to the school. Pretty much every school in Australia now has a cyberbullying policy and will have a process by which they manage that. Frustratingly, with various states of compliance or how serious they take the matter. I think we are starting to appreciate, though, just how pervasive it can be and how devastating it can be to a young person's life. Of course, coming in from the chat here, we have offered to disclose this to his parents with permission. Fantastic, and that's about that telling a trustworthy adult. Offer to disclose to his school counsellor. Fantastic, again, putting that notification into the school. And referral to Headspace for counselling. This is a tricky one because, yes, personally, I think we would do that in clinical practice. It doesn't specifically help manage the bullying itself, but certainly does manage his response to it. So I think it would depend on the question, depend on, sadly, the question author as to whether or not they would actually count this in for a point. Again, noting that in this exam, if enough people do give an answer, they do take it back and able and look at, do we actually put that in as a valid answer? And that one would be one that I suspect would go to that kind of process and would really be dependent on who actually wrote the question as to whether or not it would be accepted. Frustrating, and this is one of the reasons why I think the KFP exam is a source of frustration and difficulty for candidates. Now, we have one final case prepared tonight with 3 questions of its own, so let's try and get through that one. Let's put 2 minutes on the clock and your time starts now. time is up. Let's have a look at some answers. Now, it's no surprise that the exam is going to have questions about pediatrics. It's an important part of practice as a GP. And the college wants to assess on conditions that are going to be relevant to general practice. So have a look at the beach studies, have a look at the beach data rather, and look at those common diagnoses appropriate to pediatrics. And very quickly you can build a list of things that are going to be kind of high yield topics for the exam. Constipation in kids is an incredibly common presentation, and so we should have a pretty good working knowledge of differentials to consider, as well as things we should be excluding along the way. So what is the most likely diagnosis in differentials? Functional constipation is by far going to be the most common, most prevalent one, and so it's definitely going to get you the most marks there. Other common things that we need to be excluding is cow's milk protein intolerance, 1 mark. Hypothyroidism, while less common, does happen and is something that should be screened for. And less common, but important not to miss, is spinal cord abnormality resulting in neurogenic bowel. Because it is less common, I think you're going to be getting less marks for responses for it, but certainly in this age bracket, they're the kind of key ones that you don't want to be missing out on. Having a look in the chat here, we have benign childhood constipation. Fantastic, that's that functional constipation box ticked. Perianal streptococcal dermatitis. Yes, we'll present with some of this certainly, and certainly those hesitations and avoidance and irritable kind of patterns I think could fit. You would probably hope for a little bit more in the stem around that, being having that kind of perianal erythema or colour changes, irritation kind of thing. But something you would be wanting to look into. Helminth infection, probably less likely, but I like your having a good broad think through. Yep, perianal erythema. Yep. Now, the question here is, are you going to be seeing that potentially from the, perianal erythema is in the stem? Yes. Part of it's going to be from the passage of hard stools, can be quite irritating to the tissue as well. And if they are getting a bit of overflow, there can be that little bit of anal seepage as well that is incredibly irritating to tissue. So you do have to be a little bit cautious on that there. But yeah, it's certainly taking that into consideration, then I think I agree. That certainly puts that dermatitis picture back onto the board. So well done. All right. Let's move on to the next question then. Let's get 2 minutes on the clock and your time starts now. All right, time is up. Let's have a look at some of the answers. And so here we have A, B, E, F, and H being the key ones recommended to be investigated. Oh, well, actually, it looks like E is not highlighted, but I will say it definitely should be. I'll have to fix that later. Abdominal X-ray. Really, what we're doing there is actually assessing for the fecal loading and confirming are we seeing a constipated, backloaded kind of picture. And can also be good to look at other growth structures as well through the abdomen. Hypothyroidism is also one of those key things we don't want to be missing out on. So certainly setting off for thyroid function tests, very important. And a relatively simple test to do is send off the stool sample for overcyst parasites. We're going to catch some helminth infections as well, which certainly can lead to constipation in this age bracket. Normally you'd expect other signs and symptoms there, but there's a bit of vagueness enough in there, and it's hard for them to give you much of a history in that age bracket. So again, easy, quick, simple, cheap, send it off. Serum calcium. So this is coming into some of our more weird and wonderful kind of diagnoses that we wouldn't want to miss. And so again, if we're considering blood tests like thyroid function tests, you definitely take the opportunity to send off for serum calcium. If we're again going back to that excluding serious underlying conditions, you would consider MRI of the spine to exclude some of those spinal conditions that can lead to a neurogenic bowel. I admit it would be significantly less likely in a 3-year-old to present so late, but certainly not impossible. As is pointed out in the chat here, a 3-year-old inside an MRI machine will be fun. Yeah. Often this does have to be referred through to a tertiary centre, and not uncommonly, these are kids that need sedation for the procedure as well. So I know the Royal Children's Hospital down in Melbourne, for example, do this relatively routinely, where kids will actually receive sedation for the MRI. All right, let's follow through to the last question for this case. Let's get 2 minutes on the clock, and your time starts now. All right, time is up. Let's have a look at the answers here. And this is the bane of every parent's life. What we have here is that shiny umbilicate papule. This is a classic presentation for molluscum contagiosum, particularly with that story of one popping up and shortly after other ones forming, usually along a linear path as they've scratched and irritated the skin along a line. Admittedly, this one's in a little bit less typical position, but that's part of the stem, part of the fun. It's certainly that one up towards the nasal bridge there is just textbook classic molluscum. The gift that keeps on giving. You can have this again and again and again, and just when you think the last one has settled down, they scratch and spread it, and it starts again, again, again. So the answer is molluscum contagiosum. And if you're specifying that, you're going to get the full marks there. You'll get less marks if you have just molluscum, but it's still worth something. If you can't remember the full thing, just remember it's contagious as heck. It will spread like wildfire through daycare, school, those kinds of locations. And really, it's about trying to minimize that contact. You can use liquid nitrogen things to freeze them, dry them up, but really, it's just try and leave them be, and hopefully it settles down in good old-fashioned time. All right, that is the questions we had prepared for tonight. And of course, if you did find this helpful, let the word out there, spread the videos, try and help as many people as we can. Now, that was all I had prepared. I did want to just shout out at the end here that I am a little bit of a hypocrite. I've broken my own advice from the start of tonight and kind of said it's important to have those kind of hard boundaries in. And case in point, I started my day in general practice today at 7:30 in the morning, and I left at 7:30 at night. It was a 12-hour day. I had about 5, maybe 10 minutes to scoff down something for lunch quickly, and it was not pleasant. It was not pleasant. Try and make sure you manage your time. Protect yourself. Today really just blew out. Massively overbooked, and not a particularly fun day. These are the days where you kind of start to wonder, oh, have I done the right thing by going to general practice? 15-minute appointments can be soul crushing, so try and make sure you do slot in some breaks, some catch-up appointments if you need them, and make sure you're looking after yourself. So don't do what teacher says. I'll leave you all there for tonight then. Hope you have a great rest of the week. We'll, of course, catch up next Wednesday with 3 new cases, 3 to 4 questions per case. Have a go at playing around with the GPT I've set up to practice some questions if you want. Just remembering the formatting of the answers isn't quite where I want it to be yet, but I'll continue to kind of tweak and see if I can improve that over time as well. Again, the more cases you practice, the better you'll be. And review your formatting, because that's what catches most people out. With that, let's finish up the stream for tonight. Thanks for joining me. Always great to have you in here. And yeah, see you all next week.